In this video, we're going to show you how to build a theatre journey and apply it to a patient. Book one operation and let Velastria take care of everything that has to happen around it. The hospital's booking pack, the pre-operative appointment, and the review afterwards. A surgical journey is everything that has to happen around one operation. So it starts with the operation itself. Here is a patient of ours with an operation already booked. Open their appointments and there it is. An abdominoplasty at St. Elsewhere, which is the hospital we send patients to in this example. The operation is in the diary, with the date, the theatre, and the surgeon. Everything the journey does from now on is measured from this one appointment. Move the operation, and the whole plan moves with it. Rather than remembering all of this for every patient, you build it once as a plan. Plans live under Theatre Central, in the Surgical Journey Planner. Here is the one for St. Elsewhere. A plan is scoped to a hospital and optionally to a referral stream in a procedure. This one is for St. Elsewhere. Underneath, every step says in plain English exactly what it does, so you can tell at a glance whether a step is right without opening it. Straight away when the plan is applied, Velastria sends the hospital their booking pack, their own booking form with the patient's medical history and letter behind it, as one PDF. 1 week before surgery, it emails the hospital asking them to book a pre-operative appointment with their nurse. If a plan asks for several appointments, they go out as one email, not one each. And 6 weeks after surgery, it books the review in our own diary, with whoever is operating, and tells the patient once it is booked. Adding a step is one question at a time. First, when does it happen? Straight away, or a set time before or after the operation. Say how long and whether that is before or after surgery. Then what happens at that point? Book an appointment in our own diary, ask the third party to book one in theirs, or send a form or a document. Only that action's questions appear, so you are never looking at a form full of fields that do not apply. Now we take that plan and apply it to our patient. Back on their record, there is a Surgical Journey Planner button. One click starts their journey. Velastria has already found the operation and worked out that it is at St. Elsewhere, because it knows whose theatre that is. Choose the St. Elsewhere plan and apply it. Notice what happens. This plan is only for St. Elsewhere patients, and this patient is not yet recorded as one. Rather than refusing or applying it quietly, Velastria tells you what it is about to record and asks. Say yes, and it registers the patient against the hospital and carries on. The plan is now this patient's own journey, with every step dated from their operation. The booking pack today, the pre-operative request a week before surgery, and the review 6 weeks after. From here, each step has its own button. The booking pack goes to the hospital's bookings office, with the operation's date, time, procedure, theatre, and surgeon written into the email and the pack attached. The request to the hospital is one editable email you read before it goes. When they reply with a date, you record it against the step. And for the review, Velastria proposes the nearest free slot with the operating surgeon. Nothing has been written yet. Proposing only shows you what it would book. Each proposal comes ready ticked, and you can untick anything you do not want, or pick a different time from the list, and book it. Only now is anything written to the diary. The patient is emailed about it. If a journey books several appointments at once, they get one message covering all of them, not one per booking. Finally, back to the patient's own record. This is the proof that it worked. Open their appointments again. The operation, and alongside it, the review that the journey booked. The hospital's pre-operative appointment is not here, and that is deliberate. It is in their diary, not ours, so it stays on the journey page where you can see what they came back with. Our own diary only ever holds appointments we booked. That is a theatre journey. 3 things to remember. Book the operation first because everything is dated from it. Build the pathway once as a plan, then apply it to any patient going to that hospital, and let the plan do the chasing. The booking pack goes out, the hospital is asked for their appointments in one email, and yours are booked here.